Assume that this is going to happen. What recommendation will we make from this conference then? Anybody from the panel? If we know this is going to come in terms of potential cutbacks, okay, and that seems to be inevitable, whether it be relative or real, whichever we cut the cake, it's going to be some cutback. What can we recommend as a way of coping to make sure we still provide care for the patients we can? We have the right motivation, but you need the right infrastructure. So how do we maintain that infrastructure to a critical level that we can actually deliver what we want to deliver in the face of financial problems? Professor Pennington.
Can I make a suggestion? One villain that hasn't been mentioned, we've talked about, we haven't talked about managers per se, but we've talked about management. The microbes, they haven't been mentioned. And I think what we have to use the microbes as a political weapon to those who wish to squeeze the NHS in critical areas where infection could well be an increased likelihood, and use it as a weapon and say, look, this is bad from an insurance policy point of view. The whole point of having good control of infection is to stop infection. Like having your house insured against fire, you pay for it, because if that happens, you can pick up the pieces. You've got to have, in fact, prevention is even more important, vitally more important. It's worth every penny, and we've got to get that argument across to those who determine the budgets, that unless they spend money on infection control, infection prevention, training of staff, the cleaners in the hospital, the control of infection nurses, even the microbiologists, unless you spend money on them at an adequate level, and the level we know at the moment is inadequate, unless you at least put a sort of ring fence around the funding for that, you're going to have increased costs. Because you're going to have patients in hospital for longer with infections, you're going to have patients die, you're going to have patients' relatives suing. The costs, it's a no-brainer as an argument. At least that's the way I see it from a microbiological standpoint. We have we have an overwhelmingly strong case to make, and we should be making it stronger than we are at the moment.
So the message is that all stakeholders need to keep pushing the agenda, but one comment I would make sitting on trust management boards as an assistant medical director is that MRSA and C. diff and the quality metrics are up here, then we have 18 weeks. So despite having them now, with the money that we have up here, we have the problems we just talked about. So even if we try, I put to you, how can we explain now we're paying the cleaners insufficient funding? Sorry, at the back, we have somebody at the, yes.
Hello.
Who are you?
Julia Bloomfield from the Royal United in Bath.
Hello.
I too was a surveillance nurse when I started, so it's been nice to see you today. I think infection control is multifaceted, and we could sit here until midnight and debate what we could and could not do. The one thing that I constantly see when doing my audits of the environment on the wards in particular are the cleaners in my trust work very hard, and there's not enough of them, and we don't have enough resources. But the one thing that I think would really make a difference is having a housekeeper for every ward, so that the nurses can nurse, the cleaners can clean, and there's somebody on the ward that can look after the actual management of the ward and the environment of the ward. And it is the patient equipment that I think in my trust in particular could be better. I just didn't know if anybody else experienced that.